Hello, my name is Melissa Belair. I am an SNHU student working on a head-to-toe assessment. I have already asked my patient his date of birth and his first and last name. I'm going to go wash my hands. Okay. So, the first thing I want to do is assess for his alertness and orientation. So could you just tell me today's date, please?
10/12/2019.
And what brings you here today?
Getting an assessment done.
Excellent. So the next thing I'm going to do is have my patient test him for reading and comprehension. Please follow that. Excellent. And then the next thing I'm going to do is test his long-term memory. So could you just tell me what you did last year for your birthday?
I had a party and went camping with my friends.
Excellent. And then we're going to test your short-term ability, memory. So I'm going to tell you 4 words: cat, dog, nose, ear.
Cat, dog, nose, ear.
And then I'll have you count backwards from 100, please.
100, 80, 60, 20, 0.
Good. And then I'm going to ask you to tell me those 4 words again.
Cat, dog, nose, ear.
Great. And then I'll ask you to count backwards by 5, please.
50.
From 50 to 5. My apologies.
50, 45, 40, 35, 30, 25, 20, 15, 10, 5, 0.
Excellent. At this point, I'm going to assess my patient's head. I'm looking for asymmetry, scarring, swelling, bruising, any wounds. I see nothing. His head is round and even. He has hair distribution. At this point, I want to ask him, do you have any sinus pressure or pain?
No.
I'm going to assess his frontal sinuses, and then I'm going to press down on his maxillary sinuses. Do you have any pressure or pain?
No.
Next thing I'm going to do is listen to his temporal arteries. Good. And then I'll listen on this side. Okay. I hear no bruit. And I'm just going to feel. Good. At this point, I'm going to have you smile, frown, and then puff out your cheeks. Awesome. Good job. Now I'm going to assess his eyes. And the first thing I'm going to assess is, can I just have you look at me? They are white. There's no drainage, redness, or Icarus noted. At this point, I'm going to look inside for his optic nerve. So I'm going to look forward. I'll have you look forward. Good. I see his optic disc has a sharp margin. There is well-defined arteries. No woolly patches or papilledema noted on exam. Now we'll do the other side. I'll just have you look straight for me. I'm looking forward. I'm looking the optic disc, sharp margins, well-defined arteries, no woolly patches or papilledema noted on exam. The next thing I'm going to do is check his ocular motions. So I'm going to have you look up, down, side, side, this way, side, and then to the nose. Excellent. The next thing I'm going to do is a peripheral check. So it's a wiggle finger test. So can you just tell me, you look straight?
Yep.
I'm going to have you wiggle your fingers.
Yep.
Wiggle my fingers.
Yep.
Wiggle my fingers.
Yep.
Wiggle my fingers. Good. Thank you. Next thing I'm going to do is check his ears. Okay. So the first thing I'm going to assess is the outside of the ear. And do you have any pain?
Nope.
And have you had any trouble hearing?
Nope.
Okay, good. So now I'm going to look inside the ear. I'm going to pull up on the back a little bit. And I'm looking. And I see the tympanic membrane. It is gray and pearly white. And the cone of light is at 5 o'clock. And now I'll look on the left side. And I'm also going to look up. I see a little bit of wax on this side. The tympanic membrane is gray, pearly white, and the cone of light is at 7. And again, I see no swelling or redness to the area. So the next test we're going to do is called the whisper test. And so I'm going to whisper something into my patient's ear, and I'll have him say it out loud.
Today is Thursday.
And then go on this side.
I wish it was Friday.
Excellent. So at this point, we are going to do the Weber test. And so I will hit the tuning fork, and I'm going to place it on the top of the forehead, or sorry, on the top of the head. And I'll ask my patient to tell me if the sounds are equal in both ears, or if he hears in one ear more than the other. And can you hear it in both your ears?
Mm-hmm.
And is it even?
Mm-hmm.
Okay, excellent. All right, the next test we're going to do is the Rihanna test. And so I'm going to bang this again, and I'll put it on a bony area, and I'll just tell me when the sound stops, and then we'll put it next to your ear and tell me when you can hear it, okay?
Mm-hmm. Okay.
Good.
Yeah.
Good, excellent. And so now we'll do it on this ear, okay?
Mm-hmm.
Good.
Mm-hmm.
Excellent. Okay. So the next thing we're going to do is check the patient's nose. So I can see from the outside he doesn't have any redness or swelling, and that he has a symmetrical nose. Have you had any trouble with your nose lately?
No.
No runny nose or plugged stuffiness?
Nope.
Okay, so I'm going to look inside of the nostril. I'll have you look up, please. And so I see that the nostril is pink and moist. The mucous membranes are pink and moist. I noticed no polyps, swelling, or abrasions to the inside of the nose. And so I'll look on the other side. Excellent. So again, the mucous membranes are pink and moist. There's no polyps or abrasions noted. So the next thing we're going to do is a smell test. So I'll have you close your eyes for me, please. And I'm just going to have you smell this. And can you tell me what that smells like?
Like minty, like
Excellent.
rosemary.
Yep, mint. Good. All right, and that is testing one of the cranial nerves. So the next thing we're going to have you do is smile really big for me. Let me see your teeth. Good. And then, so what I'm going to do is put my hands right here, and I'll just have you clench your teeth and move them back side to side now. Excellent. Good. Now clench your teeth again. Don't let me pull down. Excellent job. I'm going to have you stick out your tongue. Good. And then I'm going to have you open up your mouth. Good. And then pull your tongue up high, and then down low, and then side, and then to your other side. Excellent. I'm going to look inside. Big ah. Excellent. Mucous membranes are pink and intact. Okay, so now I'm going to gag you. I'm sorry. Oh, good job. Excellent gag reflex. My apologies. All right. So now we're going to, I'm going to have them shrug your shoulders for me. Excellent. And put them down. Good job. Okay. So now I'm going to listen to his carotid. I'm going to feel his lymph nodes. And so first things I'm going to do is just check, inspect, and his neck is symmetrical, no swelling or asymmetry to one side. I'm going to feel for the postclavicular, up to the tonsillar. There's no swelling I've noted. You don't feel any pain when I palpate. Down into the clavicular. I'm going to take the moment and I'm also going to feel for any crepitus. And I don't feel any crepitus. Now I'm going to listen to his carotid arteries. And so I'll just have you pull your head over a little bit. Good. Beautiful. Then I'll have you turn. Excellent. So I don't hear any bruit, so at this point I'm going to palpate for the carotid artery.
Yeah, well,
Good, and then I'll have you turn. Excellent. Okay. So the next thing I'm going to check for is I'm going to measure his JVD. So at this point I'm going to lay the patient back. And then lay him back. Good. So I'm going to be checking his mid-sternal clavicular area. And then, let me get the other side. Okay, so mid-sternal clavicular, do his JVD, and we test it. And he's at a 2, which is excellent and normal. Anything above a 3 is concerning. The next thing I'm going to do while the patient is laying down is I'm going to listen to his heart sounds. So the aortic point is at the right side, second intercostal. Good. And then the pulmonic valve is at the left-sided second intercostal. Good. The Erb's point is at the third left side intercostal. The tricuspid valve is at the fourth intercostal. And then the mitral valve is at the fifth intercostal. Good. And then I'll use the bell side and we'll listen to extra sounds, murmurs, or gallops at the second intercostals, at the third intercostal, at the fourth intercostal, and the fifth intercostal. The patient has S1, S2 rhythm, normal sinus rhythm noted. There were no extra sounds, gallops, or rubs noted at this time. So while I have the patient down, laying flat for a moment, I'm going to listen to his interior chest. So if you could just take a normal breath for me. Good again. Good again. Good, one more time. Excellent. At this point, I'm going to sit the patient up and I'm going to listen to his lung sounds in the posterior. Okay, so I would also have had changed the patient into a Johnny to do these exams. So I'm just going to have you take a breath. Good, again. Beautiful, again. 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 And one more time. Good. I note lung sounds are clear, no wheeze. Noted. Have you had a cough or any shortness of breath lately?
No.
Okay, great. I'm just going to have you scoot up into the chair just a tiny bit so I can percuss your back. Thank you. And so again, the patient would have their shirt off for this. Good. At this point, I'm going to have the patient stand up and I'm going to check him for CVA's tenderness. And I'm just going to have you turn for a moment. Thank you so much. And then I'm just going to... Did you feel any pain?
No.
Okay, great. I'm going to have you sit back down for me, please. And have you had any urinary difficulty and pain?
No.
Okay, excellent. So, at this point, I am going to lay the patient back down. Sorry for all this up and down. And I am going to assess his abdomen. So again, the patient would be undressed and in a jammy. And for privacy reasons, we have covered his genitals. Okay. So the first thing I'm going to do is inspect his abdomen. So it is symmetrical. There's no bulging. I see no bruising. Of course, the clothes are on, but they wouldn't be on at that time. The next thing I'm going to do is listen to his abdomen. We're starting at the right lower quadrant. Excellent. Okay. So I hear sounds in all four quads. Have you had any nausea or nausea or vomiting?
No.
And any diarrhea?
No.
And when was your last bowel movement?
This morning.
And was it normal?
Yes.
Okay, excellent. At this point, I am going to percuss his abdomen. Dullness is noted to the right upper quadrant underneath the midclavicular line. Tympanic noises are heard throughout the rest of the abdomen. At this point, I'm going to palpate the patient. So just tell me very lightly. So just tell me if you have any pain when I palpate.
Mm-hmm.
Any pain?
No.
Any pain?
No.
And any pain?
No.
Okay, at this point I'm going to do a deep palpation. I'm going to try to feel for the liver. The liver edge has been palpated about 1 centimeter under the MCL. I'm going to try to feel for the spleen. I cannot feel the spleen. I'm going to try to feel for the kidneys. I do not feel the kidneys. So at this time, I'm going to take a moment and I'm going to listen to the arteries. So I'm going to listen to his renal arteries. His aortic artery. Okay. His renal. His iliac artery. And then I would also listen to his femoral arteries if he wasn't clothed. And his femoral. Okay. They were all +2. There was no bruit noted. So at this point, I am going to check his rest of his pulses. So I'm going to start with his radial pulse. His brachial. Go ahead and relax, please. Okay, I've already felt for his carotid artery, and I've already, I would also check his femoral arteries if he was unclothed. If he would be unclothed, I would check for his popliteal artery. I would check for his, I'm going to take his shoes off and I'll check for his post-tibial arteries. Thank you. I'm going to take off the sock. There you go. And I'm going to feel for his pedal pulses. Good. And then I'll do the same thing on this side. I'll feel for the popliteal artery, or pulse. I'll help take the shoes off. I'm going to feel for the post-tibial artery, or pulse. Good. And then I will feel for the pedal pulses. Good. At this point, I would assess his skin. And so he would be undressed for this part. And starting from the head, I would assess his arms, I would assess his chest, looking for any abrasions, swelling, bruising, or any open wounds. I would also be assessing for moles, any moles I found. I would apply the ABCD method, which is looking for asymmetry, borders, color, and then diameter, and any diameter over 6 millimeters would be concerning to me. So at this point, I am going to sit the patient back up. And we are going to assess sensation. And so what I'm going to do is have him close his eyes, and we're going to check for soft and dull. And I just want you to tell me if you feel soft or if you feel dull.
Dull. Dull.
Okay, here. So let's figure out what we feel first, okay? So I'll have you open up for a moment. And then this is soft. And then this would be dull.
Okay.
Okay? So my mistake. So we're going to try again. So please close your eyes.
I feel soft.
Good.
That's dull.
Good. And?
Dull.
Good. And then?
Dull.
Okay.
Soft.
Yeah. And then this one?
That's dull.
Good. And then what about this one?
That's dull.
Yeah.
Soft.
Good. So now we're going to do it to your extremities. I'm going to lift up your shirt a little bit. All right. And just tell me, soft or dull?
Soft.
Yeah. And?
Dull.
Good. And then what about this?
Soft.
Good. And?
Dull.
Good. I'm going to come over onto the other side. And just tell me.
Dull.
Yeah.
Soft.
Good.
Ooh.
Oh, no cheating. Close your eyes. All right. And this?
Soft.
Yes. And?
Dull.
Good. And then, so it's kind of hard to do it with his pants, but we'll try.
Soft.
Yeah. And?
Dull.
Good. And then?
Dull.
Yep.
Soft.
Good. And then I'll just pull the leg up a little bit. All right. And can you tell me?
Soft.
Good.
Dull.
Good. And then one last one.
Soft.
Yeah.
Dull.
Good. At this moment, I am going to check his capillary refills. So may I see your fingers, please? Press and release. Press and release. Capillary refills are less than 2 seconds, so that's normal. Let me check the other hand. Less than 2 seconds. I'll check his feet. Good. Less than 3 seconds. Less than 3 seconds. Excellent. At this point, I am going to check his reflexes. And so I'm going to just hold your arm. Good. And then your wrist, your radial pulses, radial reflex. And then your arm reflex. And then the elbow. And then elbow. Good. Now I'll check here. I'll just have you sit up just like that. Good. And we'll check your knees. Good. And then we'll check your other knee. Excellent. And then I'll check your ankle. Go ahead and relax. Go ahead and relax on my leg, my ankle. Good. And then we'll check your other ankle. Good. Excellent. So now what we'll check is your extremities. So I'll have you lift your arms above your head and then put them down. Do you have any pain?
No.
I'll have you put your arms in front of you. Don't let me push them down. Don't let me push them up. Excellent. Can you lift this leg up? Good. Can you bring the knee to your stomach a little bit? Excellent. Put it down. Can you lift this leg up? Good. Can you bring this knee to your stomach? Excellent. Good job. So now at this point, I'm going to lay you back down. Good. And so what I'll have you do is I'm going to have you lift this leg out. And then out for me. Excellent. And then in. And then cross your leg. Good. That leg is done. Oh, and then one last thing is if you could take your heel and run it down the length of your shin, please. Good job. That's the Romberg's test. And then we'll have you do the same thing here. So lift your leg up, and then down, and then out, and then across, and then heel to shin. Good. Do you have any pain?
No.
Excellent. So at this point, we'll have you sit up one last time. Good. We'll have you stand all the way up. Do you feel any lightheadedness or dizziness when you stand?
No.
Can you reach the floor and touch the ground, please? Excellent, good job. So at this point, I'm going to have you just walk to the wall and then come back. Excellent, good. His gait is steady and even. There's no dizziness or lightheadedness. Do you have any questions?
Negative.
All right. Well, that concludes my assessment for the SNHU head to toe assessment. Thank you so much for your time. Have a wonderful day.